So here's an interesting take on muscle knots or trigger points that's just popped up on my feed.
A knot is like a unicorn. We can all describe it, but that doesn't make it real. You can try and find one, but we don't have a reliable way to do it, partly because that knot can easily be normal tissues we've fooled ourselves into calling a knot.
So I think I can speak for most physiotherapists and other people who do massage as well. Once you've felt enough muscular tissue, muscle knots or trigger points become relatively obvious. Yes, they can be confused with things called lipomas, which are just little balls of fatty tissue. But if you're experienced enough, you can easily tell between the two.
We don't really know what we're looking for or what a knot even is. We don't know what they are, if it's an actual lump, if there even is a lump, if it even requires treatment. We don't have those answers.
In physiotherapy, a knot is relatively well understood. And while it's true there is often a lot of mystery around what's important and what isn't when resolving musculoskeletal complaints, one thing that we can all do a better job of is basing everything that we do on results. And when discussing whether trigger points are actually important to someone's pain or dysfunction or not, we can figure this out. For example, one of the most common places to find knots or trigger points is along the inside of a person's shoulder blade. And if you can locate a knot and apply constant gentle pressure to that spot, it creates a reflex in your brain that can instantly ask that knot to release. And if it does, it's most likely not anything else. And while I agree that there are a number of treatments that may not necessarily be effective, if we just base things on results, we'll very quickly understand what is helpful and what isn't. But ultimately, in medicine and healthcare, the language that we use matters. To suggest that we don't necessarily know what trigger points are, nor do we have effective treatments for them, unnecessarily clouds this conversation. And when we're dealing with pain and dysfunction, we ultimately need more clarity and more answers, not more confusion.